Hi everyone. Sorry, I'm just chewing. So you're gonna have to pardon the way I look today because I just finished work and I'm in no mood to like be in anything but pajamas right now. So I'm in pajamas. So today I am 34 weeks and 1 day pregnant, according to the baby center weigh thing. Baby weighs almost 5 pounds. And it feels like baby weighs almost 5 pounds. They've been really, really low this week and kind of like sitting on my bladder. So it goes from feeling like I don't need to go to the washroom at all to being like, oh my god, I need to pee. And then you go into to use the toilet and it's like a thimble. So, yeah, that's fun. No, Pan, no. Once again, I have a cat desperately trying to get on my lap. Weight gain this week, I've gained 3 pounds, which doesn't surprise me at all because I ate crap all week. And the reason for that, in my last vlog, I kind of explained that we were putting our dog down, and we did. We put him down on Friday, and it was really, really hard because he was our fur baby, and he was kind of our first fur baby. And you know, you don't really realize what a huge presence they are in your house until they're gone, and so it's been really hard without him. But it was a peaceful passing. It was just so he had a compressed spine, blown cruciate ligaments, and degenerative bone disease in his hips, and so he was in a lot of pain. And the last couple days there were several times where he couldn't even walk, where his legs would just collapse, and he was really stubborn. He would just like drag his butt behind him, and it was really hard to watch and really sad. And so we made the choice and took him in on Friday, and yeah, that was a bad day. So yeah, we haven't eaten well at all. And honestly, I don't care because I ate my feelings this week, and that's fine. So yeah, that was not okay. Symptoms, really nothing. I haven't had any heartburn. I think the baby's just kind of right down in my pelvis, and that's fine by me. So yeah, no heartburn. I haven't had any problems breathing or anything. I have had some discomfort sleeping though, like it's starting to get kind of painful on my hips to sleep on my side, despite that I have a pillow that I sleep with in between my legs, and that sort of helps, but it's just not been very comfortable. And plus I've been having these dreams about like Artemis, my dog, so I haven't exactly had restful sleep the last several nights. Other than that, I really think that's it. I know this isn't a very big video. I know it's super short, but it's been a really rough week, and it's been hard to function, I guess. I will say, you do knock it off. My dog and my cat are playing right now. I will say though that I'm feeling more hopeful about the ultrasound on Wednesday. This is kind of a weird superstition thing for me, but whenever I see 11:11 on the clock, or like 111 or 222, like for me it means good things will happen. And I have seen quite a few of them lately in the beginning of my pregnancy. And like I said, this is all a weird superstition thing, but in the beginning of my pregnancy I saw it all the time. And I was really nervous in the beginning of my pregnancy that something bad would happen and I wouldn't walk away with a baby. So yeah, seeing that stuff makes me feel way better, I guess. I know, it's really weird. Also, I talked with my midwife last week. I had a midwifery appointment, and baby's growing right on schedule. And we talked about what happens if, right? So if the cervix is covered by the placenta, even if it's just like a smidge, it's no go, like it's a section. But if it is on this Wednesday, so 34.5 weeks that I have the ultrasound, if it's covered, then I'm still going to be requesting another ultrasound for 37 weeks because I want to see if maybe it's moved out of the way. If it's not covering but still less than 2 centimeters away from the cervix or the cervical opening, then I'm going to do a trial of labor, so it will have to be in the hospital. It can't be in the birth center, which is understandable because there is a risk of hemorrhage and a risk that you do need an emergency section. The magic number really is 1 centimeter. Generally, if you're 1 centimeter or more away, you're going to have a healthy vaginal birth, but under 2, just because the risk is increased, they want to keep you in the hospital for it. So I understand that. If it's more 2 centimeters or more away from the os, then we're golden and we can go for our birth at the birth center. So, 2 out of 3 ain't too bad. I'm really hoping though that it will be like moved out of the way or not covering at least. And even if it's not covering, I'm still going to request another ultrasound at like 38 or 39 weeks to see if maybe it's 2 centimeters and we can use the birth center. Actually, I would probably request one at like every week starting at 38 weeks, so that if it's 38 weeks, it's 1.5 centimeters or whatever. That maybe at 39 it would be 2, or maybe 40 it would be 2, right? I just don't want to. I don't want to limit my options based on an ultrasound that is way ahead of my due date. And I think that the thing that freaked me out the most when I got the whole Previa thing was that it felt like everything was rushing towards me, and now it doesn't quite feel that way. I don't feel like this baby is looming, despite the fact that there's like 40 days left until my due date. I really don't feel like it's a looming thing. Like, there's still a month, and for all I know, I can go to like 2 weeks late. So with a little luck, I won't need to worry about it, and Wednesday will show everything's good and clear, and we can go ahead and avoid surgery. The one thing that I'm not sure about now is, okay, that was my brain dying. There was one thing, but it's gone. It's like shiny. That's what happens. It's welcome to pregnancy, man. Baby brain, it's just gone. Oh, that was it, right. So one thing that I'm not sure about, that I do need to talk to my midwife about, is if it is covering, and if we do need to do a section, I'm hoping that they'll let me go into labor first. I don't know if they will, because, you can bleed. But I'm hoping that, if I go into labor and then it's okay, go to the hospital, then there's the chance that, the placenta will have been moved, because I don't like the idea of taking a baby early if it can be avoided. So I have to talk with them more on that. I'm perfectly fine to wait and go into labor and then maybe go for the section, or go to see if the placenta's moved out of the way then, because I don't know. I'm not really wanting to take the baby early just in case, and I don't know. We'll see. Maybe they'll let me. I'll have to ask. Or see what they think about it, because of course it's my choice. So, but I need to know the risks. That's the thing, right? There's risks with it. Anyway, that's about it. I haven't done any baby-related purchases this week at all. It's been a shit week. And I'm really glad that we're past at least part of it, and after Wednesday, I'm really hoping for good news on Wednesday, because if there isn't, I will probably cry on the table. So, If everyone could cross their fingers for me, that'd be fabulous. Anyway, I will say goodbye, and yeah, if you have any questions or whatever, just comment and I'll reply or whatever. Okay? Take care. Have a good week.